Okay, well, welcome everyone. E ngā iwi, e ngā mana, e ngā oa mahi, tēnā koutou katoa. E mihi ana ki a koutou, koe te whai mai ki te tātou, tēnei kaupapa. Ngā mao nui ki a Professor Charles Horioka, te koekoreo o te rā. Tēnā koe, Charles. Nau mai, hara mai, ko Patrick Nolan taku ingoa. So good afternoon, everyone. I'm Patrick Nolan from the Analytics and Insights team at the Treasury, and I'm very pleased to be able to welcome you to this guest lecture. Today, we're being very generously hosted by our friends at the Reserve Bank. Those who don't know, we had a fire in our building at Treasury, so we're currently making use of the bank's facility. So many thanks to the Reserve Bank for working with us to bring this event together. Thanks also particularly to Anna and Michelle and Gareth for getting the IT working seamlessly. And so look at that, it all came together perfectly in the end. So I'll quickly pass over to Carsten, who'll make a few introductory remarks and talk, the safety briefing, and then I'll introduce the subject and the speaker. So Carsten.
First thing, just washrooms are down the hallway over here through the doors, and then down the hallway on your right. There's stairwells immediately out this door on your left, and then also by the washrooms. In the event of a fire, use the stairs. And then if you're exiting the rear of the building, we gather around by the cemetery. And if you're exiting the front of the building, up by the Ministry of Education. Generally, if you follow people who are also exiting, you'll get there. And then if they're in the event of an earthquake, drop and cover under the table if you can. Safer to stay in the building unless there's subsequent emergency, in which case similarly follow the rules for exiting due to a fire. Cool, so I think that's me.
Okay, great. Well, thank you, Carsten. So look, I'm very much looking forward to this presentation. As I was saying to a few of you before, this is definitely a topic that is very important for us to be thinking about. It's just going to be more and more important. We know about the demographic picture. We know that there's that sort of post-war baby boom. All the baby boomers are starting to reach retirement age and then are also getting older in retirement. We're seeing increases in longevity and also falling sort of birth rates. So that's being reflected in increasing dependency ratios. And as a consequence of that, we're starting to see phenomenon all around the world, what they're calling a sandwich generation. So a generation of people who are having to look after children and elderly parents. And so these are really important demographic shifts that are taking place. Now, the international literature points to three pillars that are important for when thinking about these policy issues. So there's the public pillar, which is the welfare state. There's the private pillar of savings, and then there's often the occupational pillar as well. So this presentation is really interesting and important because it actually deals with a couple of those pillars together. So what's, I think, really interesting is to understand that relationship between the public and the private pillar, and whether sort of more provision by the welfare state could potentially crowd out some of this private caring activity. So look, this is a really important topic, Charles, and I'm thrilled that you're able to come and talk to us about your research. Professor Charles Horioka from Kyoto University in Japan. So welcome, Charles. It's great to have you with us in Wellington, and thank you for taking the time to share your expertise with us. Professor Horioka is currently a professor at the Research Institute for Economics and Business Administration, Kyoto University in Kobe, Japan. And prior to Kobe, he taught at the Kyoto University, Osaka University, Stanford University, Columbia University, the University of the Philippines, and the Asian Growth Research Institute. His research fields are household economics, the Japanese and Asian economies, macroeconomics, and international finance. And his 1980 paper with Martin Feldstein on the Feldstein-Horioka puzzle or paradox is one of the most widely cited papers in economics. And he is a recipient of the Nakara Prize of the Japanese Economic Association, which is given annually to the most outstanding Japanese economist under the age of 14. So thank you again, Charles. I'll invite you to take the floor now, and you will present for about 30 minutes, 40 minutes, I'm not sure, for as long as you want, really. And then and then after that, we'll take questions and answers from the floor. So I'll pass over to you. So thank you, Charles.
Okay. Well, I'm Charles Horioka of Kyoto University in Japan. Thank you very much, Patrick, for the kind introduction. And I'd like to thank the Treasury people for inviting me to give this lecture, and also the Reserve Bank people for providing the venue at very short notice. So, my great honor and pleasure to give this talk, and as Patrick mentioned, the talk is it's about the nexus between long-term care insurance, formal care, informal care, and bequest, the case of Japan. And this is a joint paper with Emin Garamanov of American University of Sharjah in the United Arab Emirates, and Zuli Tan of Deakin University in Australia, but he's actually a New Zealand citizen, and he received his PhD from the University of Auckland. So could I have the next slide, please? Population, as Patrick was saying, population aging is occurring in almost all countries in the world, although its timing and speed varies greatly from country to country. And this greatly increased the burden of elderly care. And partly in response to this trend, many countries, including Germany, the Republic of Korea, and Japan, have introduced public long-term care insurance systems, LTCI for short. But relatively little research has been done on the nexus between long-term care insurance, formal care, informal care, and bequest. So the next slide, please. So the purpose of this paper is to examine this nexus using microdata from Japan, where a public long-term care insurance system was introduced in the year 2000. So it's been about a quarter of a century since this system was introduced. Japan was probably one of the earlier countries introducing such a system. So in particular, we use microdata from the preference parameter study. Well, actually, the name of the study has since been changed, conducted by Osaka University to analyze the impact of long-term care insurance on informal parental care, and through this channel on bequests. The next slide, please. So let me first tell you the intuition of this paper. The introduction of a public long-term care insurance system will lower the price of formal care relative to the price of informal care, at least in the case of a country like Japan, where there are no cash benefits provided for informal care. And this will induce the substitution of formal care, which has become relatively cheap, for informal care. I should note that in other countries, for example, in Germany, their long-term care insurance system provides cash benefits for informal care provided by family members. But in the case of Japan, you can benefit from the system only in the case of formal care. But in case, the substitution of formal care for informal care will, in turn, reduce the prevalence of bequests to the extent that bequests are selfishly or strategically motivated. In other words, to the extent that parents leave bequests to their children in order to elicit care from them. So analyzing the nexus between long-term care insurance / formal care, informal care, and bequests will enable us to shed light on the substitutability between formal care and informal care, as well as on the issue of whether bequests are altruistically or selfishly or strategically motivated. So could you skip the next slide and move on to the next one after that? Oh, well, this shows the organization of the presentation. So the next slide, please. Yeah. Okay, so I don't have too much time, so I'm not going to provide a detailed survey of the previous literature, but this paper is related to at least 3 strands of literature. The first strand of literature with which it's related is the literature on the interrelationship between bequests and other intergenerational transfers from parents to children, and the informal care that children provide to their elderly parents. For example, there's this very seminal paper by Bernheim, Schleifer, and Summers, published in 1985, entitled The Strategic Bequest Motive, in which they show that parents will very often use the bequest as a way of inducing their children to provide care and attention to them. Just put it a different way, they propose that parents will threaten their children with disinheritance if they don't provide care and attention to them. The second strand of literature with which this paper is related is the literature on the substitutability between informal or family care and formal care, and on what impact the availability of public and private long-term care insurance, which reduces the relative price of formal care, has on this substitutability. And the third strand of literature with which this paper is related is the literature on the impact of long-term care insurance on children's incentive to provide care to their parents during old age. So could I have the next slide, please? So now I want to talk about Japan's long-term care insurance system, because most of you are presumably not very familiar with Japan's system. Well, as I said earlier, Japan introduced the public long-term care insurance system in the year 2000. And under this system, all individuals are required to pay long-term care insurance premiums starting at the age of 40. The premium is a fixed amount. It's not dependent on your income. And if people are certified as requiring care after the age of 65, or earlier if they have developed aging-related disabilities, such as early onset dementia, long-term care insurance pays for 90% of the cost of required formal care. So you only have to pay 10% of the cost yourself. And the amount of formal care covered by long-term care insurance is determined by one's need or care level, of which there are 7 levels. So a doctor will examine you and determine how serious your disability is and how much care you require. And as I said earlier, no benefits are paid for informal care from family members or for formal care in excess of the required amount. So to summarize, the public long-term care insurance system lowers the price of required formal care, but it does not affect the price of informal care or the price of formal care in excess of the required amount. Next slide, please. This one I can just, yeah. Okay, so so much for that's Japan's long-term care insurance system in a nutshell. In this paper, I do a theoretical analysis as well as a empirical analysis. And first, I want to talk about the theoretical model, but since this part was done by my co-authors, I won't go into it in any great detail. So actually, in this paper, we construct 4 theoretical models based on various assumptions. So people, sorry, could you move to the next slide, please? Yeah. So it's a little bit hard to see this small table, but basically there are 2 types of people. There are selfish people and altruistic people. The parents can be selfish or altruistic. The children can be selfish or altruistic. And the parents and children may be of different types. They don't both need to be selfish or both altruistic. So there are basically 4 possibilities. Case 1, selfish parent, selfish child. Then case 2 is an altruistic child, altruistic parent. Case 3 is an altruistic parent, but a selfish child. And case 4 is a selfish parent and an altruistic child. So we consider all 4 of these cases because the implications are quite different depending on what assumptions you make about the parents and the children. Let's see. So could you skip the next slide and then move on? Yeah, this one here. Okay, so I want to tell you about the basic setup of the model. I won't show you all the detailed equations, but basically in this model, we assume that people live for 2 periods. A young period when they are working and earning income, and a second period in which they retire from work and enjoy their retirement life. In the first period, the person makes a decision about how much to save for the future and how much care to provide to their own parent. In the second period, the person decides how much formal care to purchase and how large a bequest to leave to his or her child, which may or may not influence how much care he or she receives from his or her child. So the parent cannot, decide how much care they receive from the children. That's the children's choice. But the parent can decide how much bequest to leave to the child, and that the size of the bequest may influence, how much care the child provides to them. So let's see. I'm not going to go through each case in detail. So could you just jump to this? There's a table like 5 or 6 slides later. Yeah, this one here. Oh, sorry, this one here. Okay, thank you. So I'm just going to summarize the 4 cases using this little table here. So this table shows the 4 cases, and as I said earlier, the 4 cases are based on different assumptions about how the parents and children are. And then the table shows whether the model predicts that what the model predicts about whether or not the child provides informal care to the parents, what the model predicts about whether parents leave a bequest to the child, what the model predicts about the impact of long-term care insurance on informal care provided by the child, and what the model predicts about the impact of long-term care insurance on whether parents leave a bequest to their children. So let me go through each of these cases. The first case, selfish parent and selfish child. In this case, the parent doesn't care anything about their child. They only care about themselves, but they may still leave a bequest because they want to receive care from their child, and they use the bequest to induce their children to provide care. So it's possible that even a selfish child may leave a bequest to their child for that purpose. Similarly, a selfish child doesn't care about their parent, but they may still provide informal care to the parent if they want to receive a bequest from the parent. So it's possible that a selfish child will provide informal care to their parent. In terms of the impact of long-term care insurance on informal care, in case 1, the impact will be generally negative, and let me explain why. So as I said earlier, the introduction of a long-term care insurance system will distort relative prices. It will reduce the relative price of formal care, leading to a substitution from informal care to formal care. So the introduction of long-term care insurance will lead to less informal care. That's why we'll have a negative impact. Turning to the impact of long-term care insurance on bequests, in case 1, this is basically the strategic bequest motive. Both parent as well as the child are selfish, and the bequest is left as a way of inducing children to provide care. So if long-term care insurance reduces the amount of informal care the child provides to the parent, it will also lead to a decline in bequests, because the bequest is basically an implicit payment for the care received from children. So the impact of long-term care insurance on bequests will generally be negative in case 1. So let me turn to case 2, altruistic parent and altruistic child. In this case, the parent will leave a bequest to the child out of altruism because they care about the child. Similarly, the child, and the parent will leave the bequest whether or not the child provides care. Similarly, the child will leave informal care because they care about the parent, will provide informal care to the parent because they care about the parent, and they will provide the informal care whether or not they receive a bequest from the parent. So in terms of whether there's informal care or whether there's a bequest, these first two cases are operationally equivalent. They both will, or at least can, lead to children providing informal care and parents leaving a bequest. What about the impact of long-term care insurance on informal care? Again, you'll have this relative price effect since long-term care insurance leads to formal care becoming less expensive. There'll be a substitution of formal care for informal care, leading to this negative effect. What about the impact of long-term care insurance on bequests? In the case of, in case two, where both the parent and the child are altruistic, the bequest is left out of love, out of, because the parents care about the child, and therefore the amount of care provided by the child and the parent will not affect the amount of the bequest the parents leave to their child. So there will be no, this model creates, there will be no effect of long-term care insurance on bequests. Turning to case three, selfish parent and altruistic child. In this case, the child is altruistic, so they will leave they will provide informal care to the parent out of love, and they will provide the informal care, whether or not they receive a bequest from the parent. But the parent, being selfish, will not leave a bequest under any circumstances. They will not leave a bequest out of love because they don't care about their child, and they will not leave a bequest in order to induce the child to provide care because they know that the child is altruistic and will provide care whether or not they leave a bequest. So under no circumstances will the parent leave a bequest to the child in this case. In terms of the impact of long-term care insurance on informal care, again, it'll be negative because of this price effect that I've been talking about. And in terms of the impact of long-term care insurance on bequests, there'll be no effect because parents will leave no bequest under any circumstances. Finally, turning to case four, altruistic parent and selfish child. The parent being altruistic will leave a bequest to their child out of love, and they will leave this bequest whether or not they get anything in return from the child, such as care during old age. The child being selfish will not provide informal care under any circumstances. Because they don't care about their parent. You might think that the child may leave a bequest, the child may provide informal care to the parent in order to enhance their likelihood of receiving a bequest, but that's not the case because they know that the child knows that the parent is altruistic and that they can receive a bequest whether or not they provide informal care. So in this case, the child will not provide informal care under any circumstances. In terms of the impact of long-term care insurance on informal care, there will be no impact because the child will not provide any informal care under any circumstance. And because the child provides no, and an impact of long-term care insurance on bequests will also, there will also be no effect there because it's not like the strategic bequest motive where the bequest is implicit payment for long-term care for informal care provided by the child. In case four, the child will not provide any informal care in any case, and therefore there will be no impact of. So long-term care insurance will not affect the amount of informal care the child provides the parent and will therefore not affect the bequest that the parent leaves to the child. So you can see that the four cases generate very different predictions about whether or not the child provides informal care, whether or not the parents leave the request, and what the impact of long-term care insurance will be on informal. Whoops, did I do something wrong? We'll take a commercial break here. Oh, yes, please go ahead. Yeah.
The last column, I'm not quite sure. Can you just explain what you mean by the last column?
The second to last column?
Yeah.
Oh, okay. The second to last column is shows the impact of long-term care insurance on informal care. So whether a long-term care insurance system is introduced, what impact will that have on the amount of informal care the child provides to the parent?
The negative means that at least.
That list care, right, because informal care has become relatively more expensive relative to formal care. Right. Is that okay?
Since we're taking a break, can I also ask a question about the Japanese system?
Yes.
Is it means tested in any way? Because what I'm wondering if like the incentive you might want to run down the bequest in order to avoid the means test. So I'm wondering if it's means tested in any way.
No, there's no means testing.
Right.
So it's just the amount of benefits you get is depends only on your physical conditions, on your care level or need level. Yeah, that's interesting thing about this. Right.
That's good. Yeah.
So even a rich person.
Yeah.
However, I should note that in recent years they have because the system is not very financially sustainable, they've modified the system so that in the case of a poor person, they only have to pay 10% of the cost. But for a very rich person, they're requiring him or her to pay 20% or 30%. So in that sense, income is taken into account. But when it was initially set up and when the data that the survey that I'm using was conducted, it was still 10% for everybody. So yes, that's good. A good question.
There's also a question online from Julius, just about case one. Wouldn't one expect both to defect as in a prisoner's dilemma and have no informal care and no requests?
Oh, that's possible. So I'm not saying that. Yeah, I guess I should be. Should be careful. It's not that there will definitely be informal care or definitely be requests. It's possible that neither will be positive. But I was just trying to say that it's possible that the child will provide care. It's possible that the parents will leave requests. But that's good. Yes, maybe I should not say yes. I should say possibly. That would be more accurate. Okay, now that we have the slide back. Oops. Okay, so you can see that the four cases they have different implications for people's behavior. So by looking at people's behavior, we can determine which of the four cases apply in the case of Japan. We can determine whether parents are selfish or altruistic, and we can determine whether children are selfish or altruistic. Okay, so that's basically a summary of the theoretical model. If there are no questions, I'd like to move on to the empirical analysis. Okay, so let's see, you move on to the next slide. Okay. So the data for this, my empirical analysis were taken from the preference parameters study, or actually the name was changed subsequently, but that was the original name of the survey. And this is a panel survey conducted by Osaka University, where I spent much of my career. And this panel survey was conducted in Japan and 3 other countries, China, India, and the United States. So it's possible to do an international comparison, but I only use the data for Japan, although it would be interesting to do a similar analysis for the other countries. And I chose data from 2011, although this is a somewhat old survey, because this wave had very detailed questions about the variables I was interested in, such as bequest motives and parental care. And it's a fairly large survey with close to 5,000 respondents, although of course I couldn't use the entire sample. The next slide, please. So let me, this is a list of the sample selection criteria. Let me just skip that for the sake of for time limitations. So the key variables that I used in this analysis are the following. BEQ-EXP, bequest expectation. This is a dummy variable that for whether or not the respondent expects to receive a bequest from his or her living parent. So, you know, since the parent is still alive, we don't know whether in fact the parent will leave a bequest to the child. So we used information on whether the child thinks they will be able to receive a bequest from the parent when the parent passes away. And primary is a dummy variable for whether or not the respondent or the respondent's spouse is the parent's primary caregiver. So whether they, basically whether the respondent or the respondent's spouse provides informal care to the parent and is the main primary caregiver. So our main interest is to see whether or not being the parent's primary caregiver enhances that child's likelihood of receiving a bequest. Whether being the primary caregiver enhances that child's probability of receiving a bequest. And of course, if it does enhance his or her probability of receiving a bequest, that means that the strategic bequest motive is operable and that the both the parent and the child are selfish. Okay, could I have the next slide, please? So we could just estimate the equation using OLS, ordinary least squares, but then that wouldn't be right because primary, whether or not the respondent or the respondent's spouse is the parent's primary caregiver, is endogenous. And those expecting to receive the bequest might be more likely to provide care, assuming the respondents are selfish. So to put it another way, the direction of causality could be reversed, with parents' bequest intentions coming first and eliciting more care from the child. So in order to overcome this problem, I used a recursive bivariate probit model. Could I have the next slide, please? Okay, and in this model, I regard primary as being endogenous, and I use eligible as the instrument for primary. So what is eligible? Eligible is a dummy variable that for whether or not the need level of the parent for public long-term care insurance purposes is assessed to be care level 3, 4, or 5, which are the 3 highest levels of care. And of course, the higher your care level, the more long-term care benefits you can receive. So if eligible is 1, means that the parent's need level is very high, or care level is very high, and that they can receive lots of long-term care insurance benefits. And we believe that this is a valid instrument because we would expect respondents to be less likely to be the primary caregiver of their parents if their parents are eligible for the 3 highest levels of public long-term care insurance benefits, meaning that they can receive lots of long-term care insurance benefits. So basically, if the parent has a high care level or high need level, they can receive lots of long-term care insurance benefits. And obviously, if that's the case, there'll be less need for the child to provide informal care to the parent. So we would expect eligible to have a negative impact on whether or not the child is the primary caregiver. So in that sense, eligible is a valid instrument for for primary, whether or not the child provides care or is the primary caregiver. But then there's another condition that has to be met for eligible to be a valid instrument for being the primary caregiver. So eligible parental eligibility for public long-term care insurance benefits cannot have a direct impact on respondents' request expectations, except via influencing the respondent's care behavior. And you know, some people have told us that this is not necessarily this condition is not necessarily satisfied, but I think we're trying to argue in this paper that you would expect this to that it's reasonable to assume that this condition is met. Could I have the next slide, please? Okay. So basically, the strategy that we're taking in this paper is that first you have eligibility, whether or not the parent is eligible for long-term care insurance. That will influence whether or not the child is the primary caregiver, and obviously, if the parent is eligible for public long-term care insurance, which means that they receive lots of benefits, then the child will be less likely to be the parent's primary caregiver. And assuming that requests are strategically or selfishly motivated, whether or not the respondent is the primary caregiver will influence whether or not they can receive a bequest from their parent. So we're trying to see whether eligible influence is primary. Oh, sorry, I guess I shouldn't touch the screen. Sorry about that. Thank you. So whether so eligible will determine will influence whether the parent or whether the child is the primary caregiver, and that in turn will influence the probability that the child can receive a bequest. So could I have the next slide? Okay, so and then I also included a number of control variables. Female, the gender of the respondent himself or herself. Female P, which is the gender of the parent. Eldest son is whether or not the respondent is the eldest son. The reason I included eldest son is that in Japan, the social norm has been traditionally for the eldest son to live with the parents, take care of the parents, but also they're rewarded by receiving the entire bequest of the parents. So to the extent that social norms are important, we would expect eldest son this dummy variable to affect the probability that the that respondent is the primary caregiver, and also whether or not the respondent receives the bequest. I also included siblings, the number of living siblings the respondent has, because the more siblings there are, the more potential caregivers there are, and you would expect that the respondent's likelihood of becoming the primary caregiver will become lower if there are lots of siblings. Married is a dummy variable that indicates whether or not the respondent is married, and I put that in because you would expect that if the respondent is married and has lots of children, that they will be too busy taking care of their spouse or their children to be able to take care of their parents. So you would expect a married person to be less likely to be the primary caregiver of the parent. Gamble, I think in the end I dropped that variable, so I won't talk about that. So could I have the next slide, please? Okay, so let me show you some descriptive statistics. So the mean of bequest expectations implies that 47% of respondents expect to receive bequests from their parents. So close to half of the respondents in the survey expected to receive bequests from their parents, which is a fairly large proportion. So bequest motives seem to be pretty strong in Japan. And the mean of primary implies that 35.3% of respondents or their spouses are their parents' primary caregiver. So more than 1/3 of respondents were the primary caregiver of the parent, which again is also quite a large proportion. And the mean of eligible implies that 14.6% of respondents have parents who are eligible for the 3 highest levels of long-term care insurance benefits. So 1 out of 7 respondents had parents who had a very high need level or care level. Okay, can I have the next slide, please? So let me show you a couple of figures, sort of basically cross tabulations. So this figure shows the proportion of respondents expecting to receive bequests, broken down by whether or not the respondent is the primary caregiver of the parent. Well, first of all, for the full sample, as I said earlier, 47% of respondents expect to receive bequests. In the case of respondents who are the primary caregivers of their parents, roughly 60% of them expect to receive the bequests. In the case of respondents who are not the parent's primary caregiver, only 40% of them expect to receive a bequest. So respondents who are the primary caregivers of the parents are much, much more likely to expect to receive the bequest from their parents than respondents who are not their parents' primary caregiver. So that indicates that that suggests, of course, this is just a cross tabulation, but it suggests that perhaps the strategic bequest motive is operable in the case of Japan, and that those who provide care to their parents are more likely to receive a bequest. Next slide, please. So this figure shows the proportion of respondents who are primary caregivers broken down by the parent's care level or need level. So I mentioned earlier that there are 7 need levels or care levels. It's a little bit complicated, but there's support level 1, support level 2. Those are the lowest levels, care levels. Then there's care level 1, 2, 3, 4, and 5. So there are 2 support levels and 5 care levels for a total of 7 need levels or care levels. Well, it's very confusing, but let me just please just understand that as you move to the right, the care level or the need level increases. Okay, so as I said earlier, for the full sample, 35% of the full sample are primary caregivers of their parents. For respondents who are not the parent's primary caregiver, respondents whose parents are not eligible for any long-term care insurance benefits, 42% of them are the parent's primary caregiver. A very high proportion of respondents are the parent's primary caregiver. In the case of parents who are not eligible for long-term care insurance, so parents who have very low parents who are not eligible for long-term care insurance. Parents who are eligible, these last 3 columns, in the case of parents who are eligible for long-term care insurance, the respondent is less likely to be the parent's primary caregiver. You can see that these 3 bars are lower than this bar here. And furthermore, while it's there's no clear trend, but you can see that there's some evidence of a downward trend in the probability of the respondent being the primary caregiver as care level or need level increases. So the higher the care level or need level, the lower the likelihood that the respondent is the parent's primary caregiver. So that suggests that that confirms my earlier contention that there is this price effect that if parents are eligible for long-term care insurance, the price of formal care declines relative to the price of informal care. Parents will be more likely to rely on formal care, and so children will be less likely to provide informal care, and children will be less likely to be the primary caregiver. So this table, this figure also confirms our expectations. Okay, could I have the next slide, please? So let me show you the regression results. This table shows the results for the first stage equation, which is the determinants of whether the parent, determines whether the child is the parent's primary caregiver. And the right-hand side shows the second stage, shows the results of the second stage equation, whether or not the determinants of whether or not the child expects to receive a bequest from their parents. And the variables in which I am most interested are eligible, whether the parent is eligible for long-term care insurance, eligible for the three highest levels of long-term care insurance, and primary, whether or not the child is the primary caregiver of the parent. Looking first at the first stage equation for the determinants of whether the parent, whether or not the respondent is the parent's primary caregiver, eligible has a negative and significant coefficient. In other words, if the parent is eligible for the three highest levels of long-term care insurance, the child will be significantly less likely to be the parent's primary caregiver. So again, that's as you would expect. And looking at the coefficients of the other variables, female has a positive and significant impact. So basically, daughters are more likely to provide care to their parents, and that coincides with my casual observation about how things are in Japan. For one thing, women have a lower labor force participation rate, so they're more likely to have time to provide care to their parents. Eldest son has a very strong impact, positive and significant impact on being the primary caregiver. So that suggests that this is evidence in favor of social norms, that the social norm in Japan is for the eldest son to live with and take care of the parent. You might think that that contradicts the earlier result that females are more likely to be the primary caregiver, but as you might recall, the data show whether the respondent or the respondent's spouse is the primary caregiver. And so the eldest son being positive means that either the eldest son or the eldest son's spouse, who is of course female, is more likely to be the parent's primary caregiver. And my casual observation is that in Japan, at least in the past, it was very common for the parents to live with the eldest son and for the wife of the eldest son to take care of the parent. So the wife of the eldest son would have to take care of someone who they're not related to at all, at least by blood. In fact, there's a joke that Japanese women did their best to avoid marrying the eldest son because then they would be stuck having to take care of their parents-in-law. And siblings has a negative and significant impact on whether or not the respondent becomes the primary caregiver. And that's, as I said earlier, because the more siblings there are, the more potential caregivers there are, and the less likely any given child will have to be the primary caregiver. And so those are basically the results for the first stage, determinants of whether the child is the primary caregiver. The results on the right side show the second stage, the determinants of whether the respondent expects to receive a bequest from their parents. And the variable of most interest is primary. Whether or not the child is the primary caregiver has a significant and positive impact on bequest expectations. So a child who is the primary caregiver is significantly more likely to expect to receive a bequest from their parents, as you would expect. And this, of course, is consistent with the strategic bequest motive that assumes selfish parent and a selfish child. So basically, it looks like the bequest is implicit payment for the care received from the child. Most of the other control variables are not significant, but the one variable that's significant is the female dummy. Females are less likely to receive a bequest from their parents, which might be due to social norms that parents tend to leave the bequest mostly to the eldest son, or to sons in general. So you can see that females are getting a really broad deal, that they're more likely to have to be the primary caregiver of the parent, but less likely to receive a bequest from their parents.
Is there any law for equal distribution?
That's a very good question. So before the Second World War, the civil law stated that the entire bequest will go to the eldest son unless the parents leave a will specifying some other division. But the civil law was revised, I think, just after the Second World War. And now the law is equal division among all children regardless of gender.
Same in India.
Okay. However, if the parents leave a will, they can, distribute the wealth differently. And furthermore, the child can voluntarily relinquish their right to the bequest. So, for example, there's a son and a daughter, and the daughter, quote unquote, voluntarily relinquishes the right to receive the bequest. Even if the parent does not leave a will, the entire bequest can go to their son. And very often the daughters or the children, other than the eldest son, will be pressured to sign a statement saying that they relinquished the right to the bequest, even though they actually may want to receive it. So you're quite right that now the law is equal division of the bequest, but there are various ways to get around that. You can, distribute
culturally and socially.
So you can either leave a will, or the children can voluntarily relinquish their right to receive. Okay, so then the final thing I wanted to mention is this row. This row, well, actually, you can see that the row has a negative coefficient, but it's not significant. So this indicates that actually, I think it is. Yeah, it is significant. I'm sorry, it is significant. I should have put some stars here. So the row is significant, and the row shows the correlation between the residuals of the two equations. So this indicates that whether or not the respondent is the parent's primary caregiver is endogenous, and that the two decisions, the caregiving decision and the bequest decision, are made simultaneously. So that means that we were justified in using a bivariate probit model. But just as a robustness check, I also tried estimating a single equation probit model, but the results were very, very similar. Okay, so could I, let's see, maybe jump a couple of slides. The next one, please. No, one more. Oh yeah, this one. Okay, thank you. Okay, so since I'm running out of time, let me turn to the conclusion. And first, let me summarize the results of the paper. In this paper, we used microdata from the preference parameter study, or the new name of the survey, conducted by Osaka University to analyze the impact of long-term care insurance on informal parental care, and through this channel on bequests. And we found that if parents are eligible for public long-term care insurance benefits, that children will be less likely to be their primary caregiver, and that this in turn will reduce the child's perceived likelihood of receiving a bequest from their parents. That's the main result of the paper. And could I have the next slide, please? And so what are the implications of this, of these findings? Well, there are three implications. First is long-term care insurance / formal care and informal care are substitutes for one another. Second implication is that bequests are strategically or selfishly or strategically motivated, namely that parents leave bequests to their children in order to elicit care from them, or to put it another way, the children provide informal care to their parents in order to enhance their chances of receiving bequests. The third implication is that the introduction of a public long-term care insurance system will reduce the likelihood of children providing care to their parents, and through this channel, reduce their perceived likelihood of receiving a bequest from them. Okay, and so let me, the next slide, please. Oh, okay, at this point, can you go back to that? Remember the results of the theoretical models. There's like a table toward the beginning of the talk. Yeah, oh, sorry, yeah, this one here, yeah, okay, good. Thank you. Okay, so the last thing I want to talk about is what do the results imply about which of these four models apply in the case of Japan? So we found that a substantial proportion of people in Japan, of children in Japan, provide informal care to their parents. So we can exclude case 4, which predicts that children will provide no informal care to their parents. And we found that a substantial proportion of the parents leave a bequest to their children, or to put it another way, a substantial proportion of children expect to receive a bequest from their parents. So that means, so we can exclude case 3, which predicts that parents will not receive a bequest to their, will not leave a bequest to their children under any circumstances. So far we have been able to eliminate cases 3 and 4. So it's between case 1 and case 2. And so far, both cases are possible because in both cases predict that children will provide informal care to their parents. In both cases predict that parents will leave a bequest to their child. But we can narrow it down further by looking at the last 2 columns. Well, the third column, the impact of long-term care insurance on informal care, its impact is predicted to be negative in both case 1 and case 2. And in fact, we found a negative impact, right? That long-term, that if parents are eligible for long-term care insurance, that children will be less likely to provide informal care or to be the primary caregiver. So both case 1 and case 2 are consistent with the result that we obtained. So finally, we look at the last column, the impact of long-term care insurance on bequests. We found that there is a negative impact that if the parent is eligible for long-term care insurance, that children will be less likely to receive a bequest. And that is the result that is predicted in the case, is predicted in case 1. Whereas in case 2 predicts that long-term care insurance will have no impact on bequests. But we found that there is a negative impact. So by a process of elimination, we found that case one is the case that applies in the case of Japan. So in the case of Japan, both parents and children are selfish, according to our estimation results. So interestingly, by looking at the nexus between long-term care insurance, formal care, and informal care, and bequest, we were able to determine whether parents are selfish or altruistic, and whether children are selfish or altruistic. So could you jump all the way to the end, the last two slides, please? So let me finally talk about the policy implications. Our findings imply that public long-term care insurance systems will have important impacts on individuals' formal care, informal care, and bequest behavior, and that these impacts should be taken into account when introducing and designing public long-term care insurance systems. For example, if a public long-term care insurance system is introduced, this will probably reduce the amount of informal care that children provide to their parents. And so parents will not necessarily be better off than before. There's just this crowding out effect that before the children provided the care, now, the parents rely on formal care, but the amount of care parents receive may not, be any greater than it was before. It's just that a different entity is providing the care. So it's quite possible that this long-term care insurance system will not, have an impact on the amount of care that parents can receive. So in particular, it must be borne in mind that the introduction of a public long-term care insurance system that does not provide cash benefits for informal care will merely lead to a substitution of formal care for informal care, which in turn may lead to a larger than expected increase in the demand for and the cost of formal care. The next slide, please. However, there's one silver lining of introducing a public long-term care insurance system without cash benefits, and that is that it may lead to a decline in the prevalence of bequests, thereby alleviating the extent to which wealth disparities are passed on from generation to generation. So bequests are not good in the sense that they lead to inequities among in the next generation, or to inequalities being passed on from generation to generation. So to the extent that the introduction of a long-term care insurance system without cash benefits leads to a decline in the prevalence of bequests, this is a good thing because it will alleviate the extent to which wealth disparities are passed on generation to generation. But of course, this is not necessarily the best way of reducing the extent to which wealth disparities are passed on from generation to generation. There are other more effective methods, such as introducing 100% inheritance tax or bequest tax. That would be the most effective way of eliminating the preventing wealth disparities from being passed on from generation to generation. But this is one unintended benefit of introducing a public long-term care insurance. Well, thank you very much for your attention.
Thank you. Well, have a seat.
Okay.
Well, thank you, Charles. That was a fascinating presentation, and it really, as I said at the start, really useful and important, particularly that the ability to think about that interaction between the public and the private pillar, and whether the reduction in the price of formal care will create out informal care. So we'll move over to questions. I see we've got some online, which are in the chat, and also if people in the room want to raise your hand and ask questions and just put up your hand. I'm going to exploit my position as chair because I can't help myself. I've got a couple of questions. One is, so see the relative price effect and the impact that that's having, but I can't stop thinking about sort of income effects. and whether there's something also there, particularly around the income of the children, whether that might have an impact on the decision as well. So basically, some people may not have been able to afford to have provided care for their parents, and so sort of what does that dimension have? And the other one is kind of a broader well-being type question. So we might see formal care crowding out informal care. So there's no increase in the sort of care provided, but what sort of other, are there other issues that it might be impacting on, such as labour market participation of females? Also, there might be some sort of broader impact. So a couple of broad questions there. So if you maybe start with those, and then maybe we'll go online and in the room.
Okay, thank you very much, Patrick. Those are both very good questions, and I'm glad you raised those. Yes, income effect. That's a very good point. I think I need to add some more control variables related to children. Whether what their income is, or how much they're working at market jobs. That will affect how much. The extent to which they can afford to provide care, or how much time they can afford to spend on providing care to their parents. So that's very important. Income effects taken into account. And in terms of your second point is also well taken, that this long-term insurance system, long-term care insurance system will have various effects, including on the labor force participation rate of the children. If the child has to provide informal care to the parents, they have that much less time to devote to market work. And especially, I found that women are more likely to be the primary caregiver, which means that if the women if there's no long-term care insurance system, that parents have to rely only on informal care, most of the burden will fall on women, and their labor force participation rate will be lower. So long-term care insurance, the introduction of a long-term care insurance system is good in terms of increasing women's labor force participation. If parents are more able to rely on formal care, the daughters will be freed up to work in the market and to realize their potential in the labor market. So that's certainly a very important side effect that should be taken into account.
Yes, great. Okay, I don't know if we've got any in the room. We've got a few online. Oh, I'll take. How about if I take? Or do you want to? Okay, this is Michelle put one in here. So, what's the difference between support and care?
Okay, right. I should have explained that more. So I said that there are 7 care levels, and the 2 lowest care levels are called support 1 and support 2. So that's those are parents who have a very mild disability. So maybe they only need a caregiver coming to the house 2 hours a week to do the dishes and help them take a shower, and then after support levels 1 and support level 2, there's care levels 1, 2, 3, 4, and 5, and those are more people with more severe disabilities. People at the highest level, care level 5, would be people who are totally disabled, and you have to put them in a nursing home because they require 24-hour-a-day care. So there's care level 1, care level 2. Those are the lowest care levels, and then highest care levels are care level 1 to care level 5.
Great, thank you. So yeah, we've got one in the room. So say from stats, I've forgotten your name, sorry. But
Alex Ferguson, I went to stats instead. I had 2 questions. The first one is around the relationship between parent and child. When you're talking about this here, it mostly seems to be the respondent is the child that you're looking at, and then it's assumed that there is one parent. Was that a population limitation that you put on there, or is there situations in which they might have 2 living parents and therefore be thinking about inheritance potentially moving across to their parents, to their other parent before it goes down to the children? And then the second one was sort of around your theoretical models. You had the one group that had no bequests, and that was based around selfishness versus altruism. I was wondering if you'd thought about putting anything in place around the wealth of those parents, just noting that in some cases bequests may not be a choice. So there may be a situation in which altruistic parents and children might not be giving a bequest simply because the parents don't have the money to bequest anything to their child, which I think might be fairly relevant given the links between poverty and health. And so people might be more likely to be more eligible for some of these things while also not having money to bequest.
Okay, both very good questions. Thank you very much. So the first question, yeah, you're right that in my empirical analysis, I dropped respondents who have two living parents. And the reason I did that is that it makes things too complicated. As you were suggesting, I think in Japan, the most likely caregiver is the spouse. So if one spouse is disabled and the other spouse is not disabled, it's very often the case that the healthy spouse will take care of the disabled spouse rather than the children. So, and furthermore, if both parents are living, it's quite likely that a large chunk of the bequest will go to the surviving spouse after one of the parents passes away. And so for both reasons, things become just a little bit too complicated. So that's why I restricted the sample to respondents with only one living parent. And in fact, a lot of other studies have also imposed that restriction as well. Although, of course, we want to know about, all people, so it would be ideal to include everyone in the sample. And the second question, yes, that's a very good point that the wealth of the parent matters, and it's quite possible that the parents are so poor that they cannot afford to leave a bequest, even though that they're altruistic and even though they would like to leave a bequest to their child. And so, unfortunately, there's no data on the parents' wealth, but somehow I should take account of that problem. Thank you very much.
Great, thanks. So we've got quite a few online, which shows the quite a lot of interest. So what I might do is I'll give you three questions at once. So we'll have to, just in interest of time, we'll do bunches. So you has asked, does it mean care for either parent or in respect of the paternal side? So I guess it's asking whether the results are related to any parent or is it particularly just for that paternal care on the father's side. There's a question here about how accurate are expectations of a bequest, as in how often does a child expect a bequest and then not get one? And then is the LTCI, long-term care insurance, a good idea from a public policy perspective? So we'll do those ones, and I promise the rest of the ones online we'll get to next. So we'll do that grouping first.
Okay, thank you. Yeah, all three questions are very, very good. So for the first one, I only looked at the respondents' own parents, and the survey does collect information also on the spouse's parents, but that would make things too complicated, so I didn't take the kind of. But I should note that some respondents are male, some respondents are female. In the case of a female's respondent, I looked at the wife's parents. In the case of a male respondent, I looked at the husband's. So it's not like perhaps the questioner was thinking that I was looking only at male respondents, but I do have respondents of both genders.
Right. Yeah.
The second question, how accurate are bequest expectations? I receive this criticism quite often that maybe the children are mistaken and maybe they expect to receive a bequest, but in actuality they won't receive a bequest. Or maybe they think they won't receive a bequest, but they unexpectedly receive a bequest. Both possibilities exist, and there's quite a bit of measurement error in this bequest expectations variable, but since I didn't interview the parents, I had to rely on what the children believe about whether they'll receive a bequest. And obviously, since the parent is still alive, we don't know whether, in fact, they will leave a bequest. But there are some surveys like the PSID, the panel study of income dynamics in the US. They have exit interviews after the parent passes away. After the respondent passes away, they interview the surviving children or the surviving spouse, perhaps, of the respondent to ask whether the respondent left a bequest and so on, so you can get actual data on the actual bequest behavior. And unfortunately, in the case of the Japanese survey, we don't have the resources to track down the survivors of the respondents to find out their actual bequest behavior, but that's a criticism that we often receive. And of course, the children do not have 100% accurate, idea of whether they will in fact receive a bequest. That's certainly true. And the final question, yes, the public policy perspective. Yeah, that's it's hard to know whether long-term care insurance is good or not. It's not necessarily all that good if there's simply this crowding out that formal care is replacing informal care. But as Patrick, you were saying, it's possible that long-term care insurance is good in the sense that it will enable women to, increase their participation in the labor force and to realize their full potential, because it's more likely for women to be caregivers than it is for men. So the long-term care insurance has many implications, some of them good, some of them not so good. So it's hard to know on balance whether it's a good thing, but I think, my personal view is that on balance, it is a good thing because whether the informal caregiver is a male or female, the fact they have to spend many, many hours providing care to the parents means that they can have less time for market work, less time for leisure activities. And so it really is a substantial imposition on their time, and that they can be freed from those responsibilities if there's this long-term care choices.
Right. So we've got a question from Kirsty Rawston. She's really asked about top-up. So are children less likely to receive a bequest from parents who receive long-term care insurance because there's no money left? Does long-term care insurance meet all the needs of those who need care, or some of those needs being met through their own savings? So basically, do people have to top up their long-term care needs, and is that eating into bequests? Malcolm Menzies has asked, there's a question about what happens to the wealth that is now not bequeathed. So it's sort of related. Jeff Lewis has asked that, do you think a reform to the Japanese system by providing in addition some level of cash subsidy for informal care would be a good idea? Thanks, Jeff, for the question. And Mark Cox has asked, do we know the impact of long-term care on the total quantum of care, formal and informal provided? i.e., does it improve the welfare of the elderly? So quite a good set of questions there, quite a wide-ranging ones. So.
Right. Oh, those are all good questions. I was really impressed with the quality and the number of questions I'm receiving. In terms of the top-up, yeah, I have to say that the Japanese long-term care system is very, very stingy, and they have very strict standards on when establishing the care level. And so very often, long-term care insurance will not provide as much assistance as you require. So you have to top it up by paying the full cost of additional care. So for example, long-term care insurance only provides for a care worker to go to the house twice a week, but you actually need the care worker 5 days a week. So for the remaining 3 days, you have to pay 100% of the cost. So it's ideally it's a very good system, but in practice they're very, very stingy, and you very often have to top it up. You have to either pay 100% to get formal care for the needs that are not met by the insurance system, or you have to provide informal care to make up the gap. Either way, there's a cost to the child, either a monetary cost or a time cost.
Yeah.
In terms of wealth not bequeathed, right. So so if the parent is selfish and the child doesn't provide any care, they probably wouldn't want to leave a bequest. But then what do they do with the money? Well, of course, if there are multiple children, if one child doesn't provide care, they can leave all the bequests to another child who does provide the care.
Right. Yeah.
If there's only one child, then of course they can leave the money to charities or to other more distant relatives.
Yeah.
But if you look at the original Bernheim, Schleifer, Summers paper about the strategic bequest motive, and if you look at their empirical results, they find that the bequest, if the parent's bequest has a much significant impact on the children's amount of attention provided by the children in the case in which there are two or more children in the family, because the threat of disinheriting the child is more credible if there are multiple children. If the child is an only child, they'll figure, oh, well, I'm the only potential beneficiary, so I don't have to give any attention to my parents. I'm going to get the bequest anyway. So and in fact, they do find that the parental wealth, the parental bequest is a much more much significant impact on the child's behavior if there are multiple children, so more potential beneficiaries. So that's a very point very well taken. Let's see. Do I favor reforming the Japanese system so as to provide cash benefits for informal care? Yes and no. I think it's a good idea to provide cash benefits so that you get rid of this price distortion. So basically, if you only subsidize formal care, you're going to reduce the amount of informal care. That's what I obtained in my regression results. So in order to get rid of this distortion, it's better to provide benefits for both informal care and formal care. In other words, that we should provide cash benefits for informal or family care. On the other hand, when Japan was debating how to set up this long-term care insurance system, they considered introducing cash benefits, but in the end, they decided not to, largely because feminists were strongly against introducing cash benefits because they were afraid that that would further increase the burden on daughters. Because females, daughters or females are much more likely to provide the care, and if you introduce these cash benefits, they would be the burden on the daughters or the females would be increased even further. So it's hard to know whether if you didn't have the social norm that it's the daughter that has to provide the care, I would be in favor of cash benefits. Right. But to the extent that there is this social norm that it's the daughters who are quote unquote supposed to provide the care, I'm not sure I would favor these cash benefits. Is there, and the last question, is there any data on the total quantum of care? Unfortunately not. That would be a very interesting, it would be very valuable to have information on how many hours children spend on providing informal care, how much formal care, how many hours of formal care is provided, and how the number of hours of informal care or formal care changes as you introduce this system and so on. But unfortunately, at least in the case of Japan, I don't think there's such data.
Great, thanks. Well, we're pretty much right at time, so we should close here. But I'm going to sneak in one last question from me. But so this is 2011 data, and I guess what would be interesting is particularly because you mentioned the recent policy change. Do you have any plans to repeat this with sort of other years? Because what would be interesting is to understand if preferences are changing over time, and also that any discontinuities introduced by that policy change. So.
Yes. I would definitely like to use more recent data, partly because I want to know how things have changed, and also the impact of the policy reforms. It's in essence a suggestion. Be sure to follow up.
Oh, great. Oh, good. Well,
so next time I'll come back in a few years. Give you.
Well, I mean, to be honest, it's given us ideas. We have very good data and on wealth and stuff. So maybe we could start thinking about doing some work in this area as well in New Zealand. So
the unit that you're heading, it analyzes micro data, right?
Yes, it does.
And you have like household surveys?
Yes, so we do. So this is courtesy of Stats Household Economic Survey. So we have very good wealth data and stuff. But let's talk about that after. We probably just shouldn't. Otherwise, I'll never stop. But anyway, thank you, Charles. It's been a fascinating presentation. I really do genuinely think that this is really important work and really interesting. I think in New Zealand, we're probably not thinking about this as much as we could be, and these sorts of questions. So, I'd love us to do more work in the space in New Zealand. So it's really great to be able to hear from, the international frontier of research in the space and the work that you're doing. So, so thank you. thank you to all the people who joined us in the room and online, and for the very good questions. Thank you particularly to the Reserve Bank for hosting us. You really did get us out of a tricky spot. For those who don't know, our building caught on fire, so thank you. You really did help us out, so appreciate that. Please keep an eye out for upcoming seminars. Next week we'll hear from Professor Sholu Mani from the University of Auckland, and she'll talk about productivity and skills on the 12th of March, and you can register for that seminar via the Treasury website. And now just let me finish with a whakatū, proverb which says that with discussion comes learning, and with learning comes understanding, and with understanding comes knowledge, and with knowledge comes the well-being of all people. So, mā te koreo ka mohio, mā te mohio ka marama, mā te marama ka matua, mā te matua ka ora te iwi. So thank you again for everyone for attending, and to Charles for presenting mā te wā. Thank you. Thank you.
Thank you very much.
Yes, we do.